My name is Dr. Zena Gabriel, and today we're going to talk about something that's quite private but very common actually, and it's female pattern hair loss. Believe it or not, skin doctors are also scalp specialists. And as a board certified dermatologist, I have studied the diseases of the scalp and actually used to do hair transplants in my residency program. But interestingly enough, female pattern hair loss affects about 50% of women over the age of 50. And it's a very private thing that people suffer from because, men get bald, but women shouldn't. So it's something that, I think that women approach with a lot of trepidation and apprehension when they talk to me about it, but it's extremely common. It's something that I think really needs to be addressed. First, when I do an evaluation of a woman who's having hair loss, I do a thorough history and physical examination, try to figure out, does she have scaling or peeling or, what comes with the hair loss, and if it's been gradual or immediate. So there's a lot of details that are involved in the evaluation. Secondly, you have to examine the scalp, make sure there's no redness or scaling or any of the visible signs of disease, like psoriasis, which is really common, or lupus of the scalp, which is quite rare, but also can cause hair loss. To be perfectly honest, I'm able to eliminate diseases of the scalp close to like 95% of the time. Mostly, women that have hair loss have something called androgenetic alopecia. A little bit of a mouthful, but what it is, it's basically the female kind of balding, and women just start losing their hair, particularly in the coronal area. And what that's from is it's basically the hormone milieu of a woman as she's going through the change of life, either menopause or perimenopausal period of her life. The estrogen and testosterone ratio that usually supports the hair follicle and causes thick terminal hairs to grow gets weak, and so you get miniaturization of that bulb. Basically, it's sort of depressing. What do? Even hormone replacement therapy doesn't help it, or some of the other bioidentical things really don't help hair. So I really believe in two products. The first product has been FDA approved for quite a long time, and that's minoxidil. We know about minoxidil. It's called Rogaine. You can buy it at Costco, and it works. There's other formulations of minoxidil that I think are superior to traditional Rogaine. One of them is called 82M. 82M is a cocktail. It has a little bit of minoxidil in it, a little bit of retinoic acid, and some of the other products that actually work at growing hair. And essentially, I think this is the food. This is what you need to have on your scalp twice a day if you're experiencing hair loss, okay? This is a minoxidil product. It's called 82M. It is prescription, so you do need to see a doctor to get it. But you can buy Rogaine over the counter. The second product I like is a stem cell agent. It's called Neogenesis. Neogenesis is a product that is applied on the scalp twice a day, and I consider this like super potent vitamins. It really works. And women start using this nightly, and in about 3 to 4 months later, close to 80% tell me, oh my God, my hair is so much thicker. So I really think this stuff works. Bottom line is, get a medical evaluation, get seen before it's too late, because it's way easier to keep the hair that you have than regrow the hair that you've lost. And 3, start using some good products, because there is some stuff out there that can help.